Hello, my name is Eli Whitaker, and I'm a student physical therapist at Campbell University. Today I'll be demonstrating how to perform the anterior drawer and lateral pivot shift tests. Both of these tests assess the integrity of the anterior cruciate ligament. So I have a knee model here, and the LCL connects the femur to the fibula. On the medial side, you have the MCL, which connects the femur to the tibia. And within the knee, you have two ligaments here. You have the ACL and the PCL, which crisscross. The ACL originates on the posterior medial side of the lateral femoral condyle and inserts on a region just anterior to intercondylar tibial eminence. So the purpose of the ACL is it prevents the tibia from translating forward on the femur, and also provides rotational stability. So there are two components of the ACL. There's a smaller anterior medial bundle, and there's a larger posterior lateral bundle. They're named according to where the bundles insert into the tibial plateau. The anterior medial bundle is tight in flexion, whereas the posterior lateral bundle is tight in extension. The mechanism of injury for the ACL is typically quick deceleration, hyperextension, or rotational injury that usually does not involve contact with another individual. This injury often occurs following a sudden change of direction while playing sports. A person typically reports feeling a popping sensation in their knee. When hit from the side, injuries to the ACL are often associated with a medial meniscus and medial collateral ligament tears, collectively known as the unhappy triad. So first we're going to perform the anterior drawer test. So we're going to have the patient flex their hip to 45 degrees and bend their knee to 90 degrees. We're going to ensure that their foot is in a neutral position. And the examiner is going to come in and sit on the patient's foot, provide some stability to keep it from sliding forward on the table. Next, I'm going to take my hands, and each hand I'm going to come back on each side of the joint here. And I'm going to palpate, making sure that the hamstrings are completely relaxed. I'm going to take my thumbs and palpate the anterior knee joint line here. And I'm going to apply a posterior to anterior force on the proximal tibia and try and get it to translate forward on the femur. If I get more than 6 millimeters, this is considered abnormal. Also, if there is a lack of infill, it's considered abnormal, which both indicate a positive anterior drawer test. So I'm going to go ahead and perform it. All right, Tyler's is intact, and also you would go ahead and compare the involved side with the uninvolved side. So the second test we're going to perform today is the lateral pivot shift test. So I'm going to grab the patient's leg. I'm just going to move it through the motion here and make sure that they're completely relaxed so that it doesn't interfere with our test results. Make sure he's not guarding any, and he's not. So your patient's going to be supine. His legs are completely extended on the table. I'm going to internally rotate his tibia. I'm going to keep internal rotation throughout the test. I'm going to bring his leg up about 20 to 30 degrees. I'm going to apply a valgus force as I flex his knee. So here we go. I'm going to do that again. And a positive test would be if his tibial plateau reduces posteriorly and it will feel like a clunk. This is significant because it tells us that his ACL is insufficient. Okay, Tyler, since you came in, you said you injured your knee playing basketball, correct? Mm-hmm. All right, so since your injury was non-contact and you felt a popping sensation in your knee while you went to turn, I'm just going to go ahead and perform these two tests so we can see if your ACL is still intact, okay?
All right.
So I just want you to stay completely relaxed for me. So first we're going to perform an anterior drawer test on you. Relax for me. Okay. We're just going to check your other side just to get a comparison, okay?
All right.
All right, good. All right, this next test we're going to do, it's just another test we can use to supplement the first one to make sure my results are what I think they are, okay?
Okay.
So again, I'm just gonna go ahead and check your other leg to get a comparison. Okay. In a study by Jane et al., 28 male patients with clinical ACL injury were examined in the outpatient department and under anesthesia. The findings were then compared with arthroscopy. The results for this study show that the sensitivity of the anterior drawer was found to be 89.3% and its specificity was 100%, while the lateral pivot shift test sensitivity was found to be 75% and its specificity was 100% in the outpatient setting. In a second study, a descriptive analytical study by Mock-Molboff et al. From 2009 to 2013 looked at 653 patients who were suspected to have an ACL rupture. The average age of these patients was 28.3 years, and it also ranged from 16 to 68 years old. They found that the sensitivity of the anterior drawer test was 94.4%. Also, they concluded that the diagnosis of the ACL injury and the decision to reconstruct ACL could be reliably made with regards to the anterior drawer and Lockman test results. Lastly, in a study by Ostrowski in 2006, they determined based on predictive value statistics it could be concluded that during the physical examination, a positive result for the pivot shift test is the best for ruling in an ACL rupture, whereas a negative result to the Lockman test is the best for ruling out an ACL rupture.